All right, we're going to go ahead and get started here. Welcome, everyone. My name is Nick Zupan. I'm the epidemiologist with the Rock County Public Health Department. Thanks for joining us for another segment of Numbers with Nick as we do a live stream here, and hopefully everyone's doing well. If you do have questions or comments, you can always pop those into the comment section, and we'll try to answer some questions at the end of the stream. If any questions come up, you can always also answer or ask us questions via social media at any time, and we'll try to get back to you as quickly as we can. If you have questions in terms of specific data questions related to the pandemic, you can also make those requests and we'll try to work those into a future video. So without further ado, I wanted to talk briefly today about the new Rock County website and also walk you through a new report that we have on our COVID-19 page for tracking the status of the pandemic. So the first things first, as you navigate to our county's website, you can see the URL here at the top of the page, but it's co.rock.wi.us/home. This brings you to our new kind of homepage as a county for Rock County. And right on the front page, you can see these icons as you mouse over them. They kind of highlight here, but COVID-19 is still front and center. So you can access the information immediately to the Public Health Department website from that Rock County homepage there. So what I'm going to focus on today, you can explore our new website and all it has to offer, but I wanted to kind of talk through what is housed now in the data section for COVID-19 and talk specifically about a new status report that we do have on this page. So when you click that link, the data icon, you'll get the reports that come up here. The first report that's linked here is the one that we're probably most familiar with, but this is the daily update. So this is the report that we have been updating every weekday for the last several weeks and months, but no changes there. So that's the first report that's linked there. The second report that we have linked here is our vaccine dashboard that's also currently being updated every weekday, but starting next week, we're going to move to a less frequent update schedule. So the vaccine data has slowed down a little bit in terms of the day-to-day increases. And as we progress through the course of the pandemic and hopefully we move out of kind of the worst of COVID-19, we're going to be scaling back the frequency with which we update some of the reports. So the vaccine dashboard, you can look forward to weekly or every other week updates in the future here, and we'll keep you updated. We'll update this language also on the website so that it's consistent with our update frequency, but just wanted to give you a heads up that will be changing. We also have linked a vaccine map, which is vaccination rates across Rock County, and you can see the variation there. We've talked about this map in a previous stream, but this is another report that is available on our COVID-19 data page and the newly revised website. The next report is called the status report, and we'll get into that shortly, but this is the new report that we've added to this page. We also include our disparities report that looks at some of the differences in COVID-19 transmission rates by race and ethnicity. We will continue to publish our municipality data reports. That one is fairly popular and basically breaks down case activity by our major municipalities here in Rock County. We will continue to update a weekly dashboard for our schools. So data for schools will continue to be updated. And then we have a couple of links here at the bottom of the page. One is to Wisconsin Department of Health Services data page for their COVID-19 data. And then the second link is to the CDC and their data tracker for COVID-19. So again, I invite you all to explore the new website. We have a lot of exciting changes to the website and developments and advancements as we move forward here. So this was just rolled out this week, and we'll be updating the website in the future to include even more information. So with that, I'm just going to open up the status report. So as you click any of these links, you'll get a little bit of a notification that you're leaving the Rock County website. And if you don't do anything, it will just automatically redirect. You can always click the link if you're eager to get into the report. So what this report replaced was the Rock County reopening dashboard. And we do have a little bit of a text explanation of why we're kind of moving away from the reopening dashboard. But as some people who have been following the situation over the course of the pandemic are probably aware, earlier in the pandemic, we had created a phased reopening plan, which was kind of step-by-step guidance for different sectors of the public to kind of maintain safe reopening of our community while reducing the spread of COVID-19. And this was based on a series of metrics that we were following over the course of the pandemic that included case transmission, hospital status, resources related to our healthcare systems. All of that information was included in that reopening dashboard. And at this point in the current phase of the pandemic, or the stage that we're in, we have decided to transition away from updating that Rock County reopening dashboard and take a look more at kind of just a general status report, using some of the key metrics and maybe some of the data points that may be an early kind of indicator before the case rates increase or the hospitalization rates increase or decrease. So that's kind of what we're trying to include in this report, and just give you a sense of if things are moving in kind of the wrong direction, which would be indicated with like that red dot, or things are moving in the right direction, which is now indicated with a blue dot. We did change our color scheme. We had used kind of a stoplight system of indicating whether things were moving in the right direction, but we transitioned to blue because it is more a friendly color for those of us who are colorblind. So you'll see that the color schemes are more now red, yellow, and blue instead of red, yellow, green. So the first piece of data that we're including in this report is the CDC metrics for community transmission. So what this is looking at the number of new cases over the last 7 days and then standardizing that by our population size and reporting that in a rate per 100,000 people. So the table we have set up here kind of breaks down the different thresholds that the CDC have put together for their mask use recommendations in the community. And currently we're seeing, and this is data based on a couple days ago, but we are seeing 195.28 new cases per 100,000 people in Rock County. So this is a Rock County specific metric. And based on the CDC thresholds, we're above that 100 new cases per 100,000 over the last 7 days. So that puts us in what they're calling the high level of community transmission. And based on their recommendation, it is everyone should wear a mask in indoor public spaces. So this is not new information, but this is a new way that we're kind of looking at the status of COVID-19 using the CDC thresholds that they've put out and trying to kind of understand where we're at with respect to the transmission. We also have in this table the number of new cases in Rock County that correspond to these rates per 100,000. Sometimes it's a little bit tricky to think about rates per 100,000, and it's easier to think about the raw number of new cases that we're seeing. So in a 7-day period, if we see 163 total cases or more, we're going to be above that high threshold that the CDC has put out. If we see something below that, then we start getting into these other categories. So that information is going to be presented, and we'll be updating this on an every other week basis in that page prior. So here, on the health department's data page for COVID-19, we do have linked the CDC data tracker. And right now this data is updated on a daily basis. So if you're interested, you can go in and take a look at the data on a day-to-day basis if you want to see more frequent updates. All right, so the graph here is simply just the portrayal of this data over time. We're looking at our trends, and as you can see, most recently, we've really seen a pretty significant decrease in the number of new cases. So we're moving in the right direction, and the data is very, very positive right now in terms of our direction that we're moving, both with respect to case activity and our severe cases in those people who have been hospitalized. So that brings us to the other piece of data that we're including in the status report. And this is simply just the number of people who are hospitalized for COVID-19 and the trends that we're seeing in that data. So this graph shows that over the course of the last couple of weeks here, we've seen another, again, a significant decrease in our patients who are in the hospital getting care for COVID-19. Most recently, I think the data is from this Tuesday. We had 11 patients in the hospital getting care for COVID-19, and that is a significant decrease from what we had seen just a few weeks ago. So again, the numbers are moving in the right direction, and we're seeing fewer and fewer kind of severe cases of COVID-19. The other piece of data that we're including in the status report is the number of people who have COVID-like illness. So this is a metric that we had formerly used in the reopening dashboard, but essentially it's looking at people who are showing up to their healthcare provider with COVID-like symptoms. So this is, again, kind of a metric that's very similar to the number of people who are hospitalized, but trying to determine how many people have those symptoms, maybe don't get diagnosed with COVID-19, but have symptoms that are consistent with COVID-19 infection. Sometimes this data can change before our hospitalization data changes or before our case rate changes. So it can be an early indicator of maybe some trends that we might be seeing in the next few days or few weeks. Again, with this data, we're seeing a pretty prominent trend in a downward direction. So positive numbers there, where we're seeing fewer and fewer people show up to their healthcare providers with COVID-like symptoms. The next set of metrics that we're looking at is our vaccination coverage. So we've broken this down into 3 segments. The first graph shows how many people have received at least 1 dose of the COVID-19 vaccine. The next graph shows how many people have completed that original series of the vaccine. So that would be the 2 doses of Pfizer or Moderna, or 1 dose of Johnson & Johnson. And then finally, we have the numbers broken down by how many people have received a booster dose. And again, as you mouse over all of these graphs, you can see the specific numbers that are represented by these different segments of the chart. But basically, we're looking at how many people have received a booster, how many people are eligible to receive a booster based on when they received their original vaccine, and how many people are currently ineligible to receive the booster shot. All right. So the last piece of information that we are including in the status report is another one of those kind of early indicators where we're looking at the concentration of COVID-19 in the wastewater. And so this data comes from the Janesville wastewater utility. We did a video on this a few weeks ago. So if you want to get some more in-depth information about what exactly is captured by the wastewater surveillance, you can check that video out. I also have linked down here the kind of state of Wisconsin compilation of all of the wastewater utilities across the state that are collecting this information. So you can get some more information from that link as well. But essentially, the higher the concentration in the wastewater, it potentially means that there's higher levels of case activity in Rock County. I know this is just for Janesville, so we have to kind of use this information and potentially extrapolate to the whole county, but I think it's a good indicator to look at trend-wise if we're moving up or down in terms of our case transmission. So you can see over the past few weeks, very similar to the other data we have in the status report, that we are moving in the right direction and have very low levels of COVID-19 concentration in the wastewater at this time. So again, this is one of those metrics that may be an early indicator of trends that we might see in the number of cases or the number of severe cases. So that's why we're monitoring this to really determine how we're doing with respect to COVID-19 transmission in the community. So that was the last metric on this new status report. So I'm going to check the chat box to see if there are any questions that have come through. Let's see if anyone has any burning questions about this information. Looks like there are no questions. If you do have questions upon watching the recording of this video, you can always reach out to us via social media. With that, we're going to close out. One thing I did want to mention before we close the video today is we are thinking about as the pandemic kind of slows down here in case activity and transmission gets a little bit less intense, and hopefully we have put kind of the worst of the pandemic behind us. We will be kind of reevaluating the frequency with which we do these videos. We may transition to a different topic or a different schedule where we're covering COVID-19 some weeks, and we may cover other health topics and the data related to other health topics in the future. So just wanted to give you all a early warning that changes are on the horizon for this video segment, and you can look forward to maybe some other topics being covered besides COVID-19. So with that, we're going to close out the video today, and everyone stay safe and healthy, and we'll see you in a couple weeks.